can you tell
Mhm.
us about the current landscape of respiratory illnesses in Canada, particularly with the rise in COVID-19 cases and hospitalizations?
Absolutely. So I feel, as per Game of Thrones, we're constantly saying in Canada, winter is coming. Everybody is scared of Canadian winter that lasts up to 10 months. And I call it the unholy trinity, the season of RSV, influenza, and COVID. And I know that my office is now bustling with an upstroke in COVID cases, influenza cases. And the reality is that this is really a difficult season for our medical system. We're already overburdened. And when respiratory diseases increase in numbers, you're often left with hospitals without any beds, wait times that are extraordinary. And the reality is, too, is healthcare staff also get sick and need time off. So this segment is so important to understand how you can best prepare yourself for the ever-evolving variants of COVID, new influenza strains, but also just common sense preventative healthcare measures.
And honestly, it just feels like everybody is sick with
Mhm.
something right now. It is definitely going around. And I'm going to go a little off script here. I'm curious more for myself. Is it possible to catch more than one at the same time if like flu and COVID were running around at the same time?
Such a sensible question, and the answer is yes. And unfortunately, those outcomes are poorer. We know that patients who are at risk of severe disease, and in some ways, patients who are at risk of severe COVID are the same as influenza, are the same as RSV. And if you get a double hit, or heaven forbid, a triple hit, you are sicker and more likely to end up in hospital and develop long-term consequences. So this is a huge point. When talking about these diseases, obviously the acute phase, that time when you're in bed with chills, fever, I mean, nobody wants that. That's unpleasant. But what is poorly understood, and I think very poorly articulated by the medical community, we need to do a better job, is understanding that there are long-term consequences with cases that are severe. I have many patients with a bout of influenza or RSV or COVID who end up with reduced quality of life. They have to go into long-term care homes. They have cardiac complications. So yes, infection with more than one is worse, but also infection with patients with comorbidities. So the more other diagnoses you have, so a patient with diabetes, with COPD, with asthma, when those get added, that compounds their risk as well. And they not only develop severe disease, but their diseases can be exacerbated. So it's kind of like a tumbleweed that's
Right.
falling down a hill, right?
And so, I mean, I know as a population, we're all tired, we're all sick of COVID-19, but unfortunately, it is not sick of us. So, how important is that vaccine this fall?
So let's go through. I sort of package everything and I don't just focus on one. I talk about your respiratory protective package. Absolutely. Let's begin with COVID. It is a shapeshifter. It is changing. And that's just the reality of science. There's mutations that we have to chase, and we have to match our vaccination formulations with the variant du jour. We are not back to square one. Thankfully, nobody wants to go back to March 2020. However, this newer variant is very different from what we've seen in the past year and a half. We had quite a quiet time when patients would call and say, I tested positive. How long do I have to stay home and watch Netflix? Whereas as of the past 3 weeks, I am seeing sicker patients who now I'm actually worried for and about their ongoing symptoms. So this strain is different enough that I'm not even calling the fall shot a booster. I'm calling it an updated vaccine. But you can't just deal with COVID. You have to address influenza, absolutely important. And we know that influenza vaccination for those patients significantly at risk, older patients, long-term care facilities are absolutely essential. But for younger patients too, to prevent transmission, right? A lot of what we do in terms of influenza vaccination is to be part of society and making sure that we're not passing on the virus to other patients. And then new to the game in terms of vaccination is RSV. It's not a new virus. It's always been around. We just haven't had an opportunity to provide anything. Hence the rhetoric now. We have, as of now, one RSV approved vaccine for patients over 60. And once again, when you have so much of life that is unpredictable, if we have the chance to be proactive, get versus reactive, I say embrace that.
Absolutely. And, I realize you're talking that everybody should get the vaccine, but are there particular groups that should absolutely, like, without question, be running for that vaccine?
Yeah, so I assume that you're referring to COVID. Absolutely. NACI has delineated, well, NACI suggests that everybody, consider getting an updated vaccine. I certainly promote that en masse in my clinic. But if you are older, if you are over 60, if you are living in a congregate living facility, if you're in long-term care, if you have a significant comorbid disease, asthma, diabetes, COPD, if you're on immunosuppressive medications, if you're on chemotherapy, if you're a transplant patient, and please do not forget pregnancy. Pregnancy is considered to be a high risk. It's not a disease, but those patients are considered to be high risk, and they should be lining up as well for their updated COVID fall shot.
And outside of vaccines, are there other steps we can be taking? I mean, I feel like we should know all of these, but it's always good to remind people of other steps you can take, right?
Absolutely, what your mama or papa told you to do. Eat well, get sleep. These are all basic things. Make sure you're hydrated. Stay home if you're sick. It's not the time, we're approaching, unfortunately, holiday season as well, right? And if you are sick, simply stay home. Put on a mask if you feel that you're at risk. And hand washing. Candace, hand washing is not a COVID thing. It is just a general health thing. I was traumatized when we had a hand washing campaign, but make sure you're just practicing those good primary prevention measures as well.
And just out of curiosity, are there differentiating symptoms so people can maybe know the difference themselves between flu, RSV, and COVID?
It's such a smart question with an answer, and essentially, no. For
Oh no.
RSV, we probably see a bit more wheezing, when you're examining the patients, but that's a nuance. And the reality is sometimes we don't know. And unfortunately, in the community, we don't have testing for influenza and RSV. That's only done if a patient, heaven forbid, is hospitalized. So, I mean, that obviously has to change, but at present, it's a little bit of a we don't know. So, you know what? The best way is to vaccinate yourself and increase your chances that you won't develop severe disease.
All right. So, what about the resources then available at Care to Know, and how can Canadians stay informed about all of these respiratory health issues and obviously a host of other medical topics?
So the other way to prepare is to be informed. And instead of Googling, Google's here to stay. I use it regularly, but when looking for health information, you want credibility. And Care to Know, it's credible, it's updated. There's input from the medical community. I certainly work readily with the team behind it, and I trust them. And I think that in the atmosphere of misinformation en masse, having a site that you feel confident going to, that you trust, is so essential. Information, good information, is empowerment. Misinformation can be a detriment.
All right. So, caretoknow.ca, correct?
Absolutely. CareToKnow.ca is a free resource where Canadians receive the latest health information, updates on new and existing treatments, and advice from Canadian doctors via email. After enrolling on CareToKnow.ca, you will receive accurate and reliable information from trusted medical experts directly to your inbox. Sign up today. It's never too late, and there's several topics that are ever expanding.
All right, wonderful. And I just want to let people know as well that we have a blog post over on whatshesaidtalk.com written by Dr. Christine Palmay that goes a little deeper into this subject in case you wanted to learn a little bit more. And Christine, thank you so much for joining me today.
Pleasure.